Imagine for a moment. Common medications, the very ones you trust, could be silently shrinking your brain's memory centers by as much as 28% in a single year, dramatically increasing the risk of dementia, especially for seniors. It's a sobering thought, isn't it? Did you know that by the time you finish watching this video, almost 20 more seniors will have been diagnosed with dementia? That's one every 66 seconds. But here's the truly alarming part. What if aging isn't the primary culprit? What if the answer lies right next to your medicine cabinet? You've been told these medicines are safe, common, even necessary. Yet, recent studies are beginning to paint a very different, deeply concerning picture. An astonishing 99% of seniors are completely unaware that at least one of their daily medications has the potential to reduce the size of vital brain memory regions by over 28% in less than 12 months. Pause and let that sink in. Now, what about the pharmaceutical industry? They've been aware of this for years, and yet they continue to reap billions by marketing the very same medications. That could be accelerating the cognitive decline of millions of our elders. Consider this. A 2023 study published in Neurology and Aging. Research revealed that just one class of these medications elevated the risk of dementia in older adults by a staggering 49% within 2 years of use. From seemingly innocuous to potentially much the strain we read about to unveil the top 9 drugs that can cause rapid memory loss and dementia in this video. These are medications prescribed to millions for seemingly harmless reasons, but they can cause your brain's crucial memory areas to shrink, and you probably aren't even aware of it. Before we dive in, I want to hear from you. In the comments below, tell me what medications you use daily, and if you've ever experienced sudden forgetfulness or brain fog. Every comment is reviewed, and we offer tailored insights in our responses. Don't stay silent. This information might just save your sanity. Now, without further ado, let's get right to number 9. And please, don't be fooled by its position on this list. Almost every senior's medicine cabinet contains one of these. Before you even realize it, it could be jumbling your thoughts. Number 9. Benadryl diphenhydramine. Millions of people rely on diphenhydramine, that familiar pink pill, to help them sleep, relieve allergy symptoms, or ease a cold. It's inexpensive, readily available over the counter, and you probably have it on your nightstand right now. While you might think you're just taking it for better sleep or allergy relief, Benadryl could be significantly affecting your hippocampus, the part of your brain responsible for forming new memories. Benadryl belongs to a class of medications called anticholinergics, which block a crucial neurotransmitter called acetylcholine. This molecule is essential for maintaining alertness and creating new memories in the brain. As we age, our brains become increasingly dependent on all available acetylcholine, and if this medication interferes with that delicate process, the outcome can be disastrous. A 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who regularly took anticholinergic medications were 54% more likely to develop dementia than those who did not. So, how can you protect your memory? First, steer clear of anything containing diphenhydramine, especially if it's marketed as allergy relief, PM, or nighttime. Often, these are just Benadryl in disguise. For allergies, consider more modern, non-sedating alternatives like loratadine, Claritin, which don't cross the blood-brain barrier and are far safer for long-term use in elderly patients. Never stop a medication abruptly, but also, don't assume that over-the-counter drugs are always safe. Next up is a medication frequently touted as gentle on the stomach, but it can actually starve your brain of the nutrition it needs to stay healthy. Number 8. Proton pump inhibitors. Nexium Prilosec. At number 8, we have proton pump inhibitors, or PP is like Nexium and Prilosec. These medications, which drastically reduce stomach acid, are commonly prescribed for acid reflux, GERD, and heartburn. Because symptoms often return as soon as people stop taking them, many seniors remain on these drugs for years, even decades. But what's often overlooked is how PPs affect the absorption of vitamin B12, a critical nutrient that protects the brain and supports emotional stability, memory, and focus. A 2016 study published in JAMA Neurology, which analyzed nearly 73,000 adults aged 75 and older, found that regular PPI users had a 44% higher risk of dementia than non-users. By excessively reducing stomach acid, PPs prevent the body from absorbing not only vitamin B12, but also calcium and magnesium, both vital for brain cell signaling and neural transmission. Without them, neurons struggle to fire effectively, leading to misfiring, disorientation, and memory loss that often mimics early Alzheimer's disease. And the problem runs even deeper. PP have also been shown to increase the amount of amyloid beta plaques in the brain, harmful proteins thought to be a major cause of Alzheimer's. Fortunately, safer alternatives exist. If you take a PPI daily, talk to your doctor about gradually transitioning to H2 blockers, such as famotidine. While not perfect, H2 blockers are less likely to impair cognition. Additionally, chewing a small amount of deglycerinated licorice, a natural substance that coats and calms the stomach lining, can relieve symptoms without impacting cognitive function. The next drug is commonly used to manage bladder issues, yet it could be severely disrupting short-term memory and emotional balance. Number 7. Bladder-controlled drugs, oxybutynin, ditropan. Number 7. Bladder-controlled drugs. For seniors grappling with overactive bladders or urinary incontinence, oxybutynin, marketed as ditropan, is a frequent prescription. On the surface, it seems like a practical solution. No one wants the inconvenience or embarrassment of frequent restroom breaks. However, this drug works by inhibiting acetylcholine, the same critical brain molecule that Benadryl interferes with. What's more, oxybutynin directly impacts memory areas in the hippocampus and penetrates the blood-brain barrier more readily than some milder This makes it particularly risky for seniors, especially with long-term use. A 2019 study published in the BMJ found that individuals over 65 who took powerful drugs like oxybutynin for more than a year were 49% more likely to develop dementia. That's almost 1 in 2. What's even more concerning is that many seniors are never informed of these cognitive side effects. They're told it will help with bladder control, not that it could accelerate mental decline. The damage is often dismissed as just aging. Patients report feeling disoriented, losing things, forgetting appointments, or struggling to follow conversations. Rarely is it traced back to the medication until significant harm has occurred. So, if you've noticed any mental changes, you don't have to continue taking oxybutynin to maintain control. These changes aren't just your imagination. Thankfully, newer drugs exist that work differently and have a much lower impact on memory, such as mirabegron, sold under the brand name Mirabegron. These medications are generally considered safer for elderly patients because they do not impede acetylcholine. Number 6. Statins, simvastatin, atorvastatin. Number 6 on our list, statins, particularly for those over 60. Statins are among the most commonly prescribed medications worldwide. They are designed to lower cholesterol and reduce the risk of strokes and heart attacks. The two most popular are simvastatin, Zocor, and atorvastatin, Lipitor. But here's where the problem begins. Cholesterol is not just a heart issue, it's essential for the brain. Nearly 60% of your brain is composed of fat, and cholesterol is crucial for the formation and maintenance of the myelin sheath, a protective layer that ensures smooth transmission of nerve signals. Drastically reducing cholesterol may inadvertently be depriving the brain of essential nutrients. A 2023 study published in Frontiers in Aging, Neuroscience found that seniors over 70 who had been taking statins for more than 3 years were 26% more likely to experience mild cognitive impairment, and those on high doses showed significantly more pronounced reductions. Even more troubling is the fact that some patients experience sudden onset memory loss, unable to recall names, recent conversations, or even familiar driving routes. It's vital to understand that not all statins affect the brain in the same way. Some, such as rosuvastatin and pravastatin, are considered less dangerous in terms of cognitive side effects because they are less likely to penetrate the blood-brain barrier. If you've been on statins for years and are experiencing brain fog, forgetfulness, or confusion, it might be time to discuss a dose reduction or explore other options with your doctor. Don't wait until the damage is irreparable. Acting now increases your chances of safeguarding your intellect for years to come. Number 5. Benzodiazepines, lorazepam diazepam. Coming in at number 5, benzodiazepines. Among the most frequently prescribed pharmaceuticals for anxiety and sleep issues are benzodiazepines, which include Ativan, lorazepam, Valium, diazepam, and Xanax, alprazolam. They work by boosting GABA, a neurotransmitter that calms the brain and reduces overstimulation. At first, they appear to be lifesavers, promoting sleep, calming the mind, and easing anxiety. However, these medications often become a trap. A 2022 study published in the BMJ, which tracked over 8,000 seniors for 6 years, found that those who had used benzodiazepines for longer than 3 months had a 51% higher chance of developing Alzheimer's disease. Long-acting benzodiazepines like diazepam, which linger in the body longer and accumulate in adipose tissues, including the brain, increase this risk even further. This is a form of pharmacological sedation that slows neural activity. Your brain stops learning as quickly, becoming less adaptable, less effective, and more vulnerable to emotional sluggishness, memory lapses, and disorientation. Seniors using benzodiazepines frequently report feeling disoriented, disconnected, or simply not themselves. Worst of all, withdrawal symptoms like anxiety, agitation, and insomnia can be quite severe when people try to stop, making the drug seem necessary when it's actually causing the problem. Here's what you need to do to address this. Do not abruptly stop using benzodiazepines if you've even taken them for more than a few weeks, as this can be dangerous. Instead, gradually reduce the dose in close consultation with your physician. Alternatives that can help restore calm without impairing memory include cognitive behavioral therapy for anxiety and sleeplessness, or buspirone, a non-sedating anti-anxiety medication. Number 4. Amitriptyline Elavil. Number 4. Amitriptyline, sometimes known as L. This older antidepressant is still frequently prescribed today for pain, sleeplessness, and occasionally even migraines. It might initially seem like a multi-purpose miracle drug. On the inside, however, it's one of the strongest anticholinergic drugs currently on the market, meaning it profoundly inhibits the activity of acetylcholine, the neurotransmitter that facilitates communication, memory formation, and cognitive function. In fact, it blocks it so effectively that long-term usage is likely to have cognitive impacts, rather than just potential ones. In a large 2015 study published in JAMA Internal Medicine, researchers examined nearly 3,400 participants aged 65 and older. They discovered that individuals who took larger cumulative doses of anticholinergic drugs, such as amitriptyline, over a 10-year period, had a 54% higher risk of dementia. That's more than half the typical risk, not just a small increase. The horrifying truth is that many of these individuals were never informed that the medication could impair their memory. Amitriptyline was often recommended for nerve pain or sleep problems, and they gradually began to notice effects including short-term memory loss, difficulty finding words, and hazy concentration. A large dosage isn't necessary to create issues over years. Even low-dose amitriptyline used nightly can cause a gradual, undetectable decline in brain function. The harm occurs in silence, with no early warning signs or symptoms. Just a slow deterioration that mimics aging but is actually drug-induced cognitive impairment. If you or a loved one is taking amitriptyline, consult a doctor about your options. Duloxetine and gabapentin are two medications that can provide relief from nerve pain without the same anticholinergic side effects. For sleep, consider low-dose doxapan, which has a considerably milder anticholinergic effect, or melatonin. Additionally, newer antidepressants, generally considered safer for the brain, such as sertraline or escitalopram, can be used to support mood. Number 3. Paroxetine Paxil. The third drug is Paxil. Paroxetine, marketed under the trade name Paxil, is one of the most frequently prescribed selective serotonin reuptake inhibitors, or SSRIs, for anxiety and depression. On the surface, it appears to be a modern antidepressant, intended to be kinder than older medications. But here's what they often do tell you. Paroxetine interferes with acetylcholine in the brain, making it the only SSRI with strong anticholinergic effects. That single element significantly differentiates it from its SSRI siblings, such as sertraline or escitalopram. In a comprehensive 2021 review published in Frontiers in Psychiatry, researchers examined the cognitive characteristics of older patients taking various SSRIs. They found that paroxetine users experienced quantifiable decreases in verbal recall, short-term memory, and attention span within the first 12 months of using the medication. Furthermore, compared to seniors using other antidepressants, those taking paroxetine had a 30% higher chance of exhibiting early indicators of cognitive decline. Ironically, despite being frequently prescribed to calm mood, it eventually impairs mental clarity and emotional control. Here, the solution is simple yet crucial. Seniors should avoid paroxetine entirely. Paroxetine has been added to the American Geriatric Society's list of potentially unsuitable drugs for older persons, known as the Beers Criteria List. If you're currently taking it, discuss with your doctor the possibility of switching to safer substitutes that don't carry the same cognitive risks, such as escitalopram or Additionally, supplementing with B vitamins, particularly B12 and B6, can help naturally support mood. Number 2. Antipsychotics. Olanzapine, risperidone. The second drug is antipsychotics. The fact that many seniors are unaware they are even taking an antipsychotic makes this one particularly concerning. Medications such as olanzapine, Zyprexa, risperidone, and quetiapine, Seroquel, were initially developed to treat bipolar disorder and schizophrenia. However, they are now commonly prescribed off-label to older patients for behavioral changes linked to dementia, agitation, or sleep issues. Yes, these medications are used in hospitals and nursing homes for elderly patients who are simply difficult to manage, disoriented, or restless. Even though they are meant to treat serious mental illnesses, the repercussions are disastrous. A thorough 2022 study published in The Lancet Healthy Longevity, which monitored over 25,000 older individuals, found that seniors administered antipsychotics for behavioral symptoms had a 71% higher chance of experiencing increasing cognitive loss within a year, even if they had no prior history of dementia. Even worse, these medications raise the risk of stroke, unexpected death, and extreme drowsiness, which can result in falls, hospitalization, or long-term institutionalization. It's a vicious mechanism. These drugs block dopamine, a neurotransmitter essential for memory processing and executive function, in addition to its links to motivation and mood. When dopamine levels plummet, the brain becomes slow and reactive. This explains why elderly people using antipsychotics often appear lifeless, emotionally flat, or zombified. Family members begin to mourn someone who is still physically present as their personalities simply fade away. The first step in addressing this scenario is to ask challenging questions. If you or a loved one is taking one of these drugs, ask the doctor why the prescription was recommended and if it's truly essential. Non-drug therapies, such as establishing structured routines, reducing noise and overstimulation, treating pain or discomfort, and enhancing lighting and sleep hygiene, can often effectively alleviate behavioral symptoms. When medications are absolutely necessary, lower doses taken for shorter periods of time can lessen the risk. However, these medicines are typically utilized for convenience, rather than out of genuine necessity. Tragically, many families aren't even informed about the full effects of these medications. Watching their loved one deteriorate without knowing the cause is chemical, not natural. Number 1. Anticholinergic polypharmacy. Anticholinergic polypharmacy is number 1. This is a concealed risk that hardly anyone discusses, yet it's one of the main causes of drug-induced dementia in the elderly. You might think a single powerful drug would top this list, but the most harmful prescription for seniors rapidly developing dementia isn't one tablet. Anticholinergic polypharmacy is the term for the stealthy, creeping side effect of concurrently taking several drugs with anticholinergic effects. Consider this situation. A senior takes amitriptyline for pain, oxybutynin for bladder problems, and diphenhydramine for sleep. When combined, the cumulative anticholinergic burden increases dramatically, even if each one by itself might only result in minor memory issues. This isn't merely a theoretical issue. In a 2022 analysis published in Age and Aging, researchers studied nearly 280,000 older individuals. They discovered that those with the highest anticholinergic load had a 120% higher chance of developing dementia within 10 years. That means the risk is more than doubled. And here's the worst part. The majority of these elderly people were completely unaware they were taking anticholinergic drugs at all. When you block acetylcholine from several different directions at once, your brain doesn't just slow down. Decomposition sets in. Underuse causes synapses to shrink, neurons to wither, and the brain to enter a hypoactive state, eerily similar to Alzheimer's. It doesn't take a miracle to fix this. What's needed is a comprehensive medication review. Request that your physician or pharmacist assess the anticholinergic load of all your prescription medications, over-the-counter drugs, and even supplements. Professional software and online resources can help compute this cumulative burden. Once you understand the situation, you can work towards prescribing, gradually tapering off unwanted drugs, replacing them with safer options, and actively adjusting the chemistry of the brain. This is the most empowering aspect of this entire video. Dementia brought on by drugs is often curable. Many seniors recover their energy, lucidity, and memory function in a matter of weeks or months after the chemical stress is removed. Given a chance, the brain can bounce back. Anticholinergic polypharmacy is not only harmful, it's entirely avoidable. As a result, it ranks as the top concealed medical threat to our aging population's mental health. Now, we'd like to hear from you. Which of these drugs do you currently take? Since starting a new drug, have you experienced any changes in your personality, forgetfulness, or brain fog? Would you be open to discussing a medication review with your doctor this week? We would love to hear your thoughts and experiences, so please share them in the comment section below. Thank you for viewing.